And I'm so delighted to be along with some of the elite speakers, especially the past president of Endocrine Society, our dear friend Bob. So thank you. So my duty is to discuss on some of the expanded indications of automated insulin delivery. And this is a title given to me by Dr. Benshi Sabu. And let me try to have some of the cases, and all the cases that I am presenting today, they are all very old cases, and they are currently on 70G. So these are my disclosures. A couple of months ago, I had an opportunity. This was a very rare, unique opportunity to be at an advisory board meeting. And this was an advisory board meeting where I was invited along with some surgeons, urologists, oncosurgeons, gastroenterology, they were also surgeons, and then general surgeons. And my duty was to discuss with them on the newer insulins. So there are a lot of newer medications for diabetes, and so they would like to get the opinion from me on when to use and when not to use the longer acting insulins, the ultra rapid acting insulins, and so on. But very soon I realized that they are discussing on how to treat diabetes when the people are on high dose of steroids, when somebody has got the pancreas completely removed because of, for example, cancer. And I realized within an hour that our own fraternity, our friends in other specialities, they are actually not at all aware of the availability of advanced hybrid closed loop systems. They are not, and they are working with us. And please remember the fact that doctors in all these specialities, irrespective of where they teach and where they work, they are all forced to treat diabetes. Whether it's an ENT surgeon or a cardiologist or a nephrologist, they are forced to treat diabetes because of the pressure from the patients. So it is a fact. It is a fact that there is a knowledge gap. And that is a reality. There is a huge knowledge gap, may not be in India, maybe all over the world. And this has been the journey of Minimed in India. And very fortunate, and with all humility, I have been in this journey from beginning onwards, from 2004 onwards, right from the launch of insulin pumps. And I would like to take this opportunity, of course, this is a closed door meeting. I would like to take this opportunity to congratulate and also to express our gratitude as doctors, express our gratitude as patients with diabetes for the consistent performance and the consistent work that Medtronic has done in India. Uninterrupted presence of Minimed in India. That is something huge. And that is an acknowledgement from all the doctors in India, because many have come, but they have just vanished. So Minimed has been consistently present in India, upgrading the devices and making all the newer devices available in India, and that too for more than 2 decades. Thank you so much. And this is a paper, and this is the first 25 patients on 780G from our center after the initial few months of its launch in the country. Incredible performance. And we never even dreamt of achieving more than 80% time in range in type 1 diabetes. So type 1 diabetes, of course, 40% or maybe 50%, but never. It is an incredible accomplishment. More than 80% time in range with negligible time below that, and that to level 1 hypoglycemia. Thanks to, so I always used to tell my patients, this is not an insulin pump. This is far beyond that. We have reached beyond the innovation of an insulin pump. This is automated insulin delivery, and consistently these are the responses from the patients. I have slept, I have slept peacefully for more than 7 hours, 8 hours, and this has happened to me first time ever after the diagnosis of type 1 diabetes. So this has been concerned. I am so happy that in some of the newer clinical trials, apart from A1C or time in range metrics, sleep is also now considered as an endpoint. Am I right? Sleep is now an endpoint, because from a patient's perspective, sleep is more important than A1C and time in range, because that all actually is a determinant of the overall quality of life. And let me now discuss some of the cases. And this is Rupa, a 37-year-old girl, and with a type 1 diabetes of 30 years, and she was reluctant to go for an insulin pump therapy. So I have requested her for a long time, and she is comfortable with an A1C of 8 to 9%, but Despite her exercise, see, mood swings, anxiety, distress, insomnia, and she's working somewhere, and with difficulty I had to convince her over the years that this is the glucose variability of more than 50%, and this is the glucose management indicator aligning with the lab measured, and this could be the result of glucose variability, and this is a vicious circle. The adrenergic symptoms, the cortisol surge, the stress, the poor sleep, and this is a vicious circle. And somehow when 780G got launched, I told her, now there are no manual interventions, because her main concern is I have to manually intervene, and this is only a device where I have to be balancing, I have to be measuring everything. And I told her that more than 70% of the time now it is automated, and this is after the same lady. Look at the GMI, around 7% and around 80% time in range, and within 3 months she reported better mood. For the patient it is mood swings, for the doctor it is time in range. For her it is a sleep, improvement in the sleep, better mood, and feels normal, back to normal again. And this is a call to action from our side, and this is along with Manoj and Benshi when we made a request. And this is a human right. We believe it is a right of everybody, especially children living with type 1 diabetes, to have the government provide them with a free supply of advanced hybrid glucose. The only one available in India is 780G, and the supplies. It is a human right. The only problem, the only obstacle now is many doctors who are probably involved in this, they are not aware of the systems and the benefit on how they are improving the quality of life and how it prolongs the lifespan, retaining the overall quality of life. And this is another guy, Matthew. This time it is a 62-year-old gentleman retired from government service with type 2 diabetes, because I am supposed to discuss on extended indications, and his reason for visiting me is severe neuropathic pain and erectile dysfunction. So these are cases from some time back, and this is the first visit, and started him on a basal bolus regimen, and this is before and this is after the conventional insulin pump therapy. This we have published earlier. So within 2 weeks of initiating a continuous subcutaneous insulin infusion, this guy reported improvement in neuropathic pain, and a month later improvements in erectile dysfunction, and currently he is on 780G doing extremely well. The pain has completely disappeared, and earlier also we have in 2007 presented at the American Diabetes Association on dramatic response to neuropathic pain, intractable pain of neuropathy, and this is within 10 days of initiating a CSII. And we have also done a investigated initiated trial by name Excited on erectile dysfunction, where again we have shown that compared to a multiple daily injection, there were significant improvements in the international index of erectile function with the use, and the same were incorporated in the first insulin pump guidelines which appeared in DTT in the year 2010. So moving to another story, and this is again type 2 diabetes, a 28-year-old working in the multinational company, and he was treated by a cardiologist, and the cardiologist was treating his diabetes, and the cardiologist somehow told him that no, I cannot treat your diabetes, please go somewhere else and meet a diabetes specialist. He had done a CABG 15 years ago, but his problem is he is having angina, and this angina is even on mild exertion, so he will feel the pain. And that is very typical pain also. And the cardiologist said that I have done whatever possible from my side. I have given you all the medications. But now somehow you treat your diabetes. And during the first time I met him, his A1C was 11.3 on glibenclamide, metformin, biphase human insulin, started him on basal bolus, and then on 722. And then this was the continuous glucose monitoring data. And currently he is on 780G. So the message here is, soon after he was on a pump, the pain of angina disappeared, and that is something which is so skeptical, and even the cardiologist and even myself, I was also surprised. The pain of angina completely disappeared, and he was able to do and perform normal activities. And earlier he was on multiple other medications. In between there were normal hemoglobin A1C, and he said that he has done continuous glucose monitoring also, but he found that even after control of diabetes there was no benefit. But with 780G, he is currently 76 years old and very happy with much better quality of life. And this is another case of a fibrocalculous pancreatic diabetes, a 39-year-old lady 10 years, you know, in FCPD, that is pancreatic diabetes, they are highly insulin sensitive, requiring only a small doses of insulin but recurrent episodes of hypo and hyper. And this has been the transition from 722 to 640 to currently 780 G. And for the first time, she has reached a hemoglobin A1C of 6.5%, no hypoglycemia, doing extremely well. I know some of you will have questions in the era of GLP-1 dual agonist. What will be the role of 780 in type 2 diabetes? Since I have discussed on some of these extended indications. Remember, there will be close to 13 or even 20% or even 30% who are non-responders to GLP-1. Could be only for weight reduction, but there is another subcategory and they cannot tolerate. And in clinical practice also we have seen, and that probably translates to millions with type 2 diabetes in our country. Millions. They cannot simply tolerate, and or else they cannot, they will not respond. Of course, there are super responders, there are responders and non-responders. And these are from the clinical trials, and we know from the real world also, there are non-responders to GLP. And these are the type 2 diabetes patients who are really suffering, distressing, disappointing, with pain, with mood swings, with insomnia, with distress, with anxiety. And there, pump is useful. So let me make a concluding remark here. In our country, or probably in many countries, HCl as a very, very powerful tool in the management of uncontrolled diabetes or intractable neuropathic pain, and with many other pleiotropic benefits, is grossly underutilized. So let me take this opportunity to invite all of you to the 14th year of JPF, July 10, 11 and 12. The venue remains the same. And also, of course, to our meeting as the president of DTech, inviting all of you to the DTech from 8 to 10th of Mumbai, an exclusive technology meeting in diabetes. Thank you very much, dear friends.
Thank you, Dr. Jyotidev. Very, very powerful